Press. We're here to have a conversation today about more time for change, the overprescribing of psychotropics into the veteran community. For the last 20 plus years, this has been troubling the veteran community and killing members, brothers, sisters, war fighters in mass amounts. Over 156,000 veterans in the 20 plus years of the global war on terrorism have taken their lives. We understand that 68% of veterans inside the Veteran Health Administration are currently being prescribed psychotropics. We understand that an additional 28% of veterans are being prescribed anti-psychotic medicines. Ladies and gentlemen, this is a problem. The problem lies in that we are overprescribing these individuals with these psychotropics, and the harm that is coming with them is not being communicated to these individuals. In the early 2000s, the VHA implemented an opioid policy inside the VHA and eliminated the problem of opioid addiction and overuse within the system. And it is very similar to the problem that we have today. This can change. We can change this now. The VHA can change this today. And not one more life needs to be sacrificed or lost. We've gathered our friends and families, those that have been harmed by this. And we're going to be having a summit today to talk about the real dangers that come with these medications prescribed into our community. We're asking for a couple simple things. Informed signatory consent. We're asking for proper prescribing policies. We're asking for some dignity. Dignity in our mental health, dignity in our ability to facilitate the needs, to keep us straight and narrow, and contributing to society, and being the veterans and those community leaders that we know that we are. But because of these medications, we're being put into a corner, we're being over-medicated, we're killing ourselves. We should be ashamed. Ashamed. Today that changes. I want to introduce you to Brian and Kim Brumfeld. Their son, Connor, was 22 years old, served in the United States Army, took his life because he went to the VHA and was prescribed Wellbutrin. A very similar circumstance happened to my dear friend, Corporal Paul Kludak. Went to the VA for smoking cessation, was provided Wellbutrin, and within 4 months he killed himself. It's unacceptable. I want you to hear their story. Brian, Kim.
My name is Brian Brumfield. My wife and I are here from Marysville, Ohio. And I'm here to talk about my son. My son, Connor Brumfield. This is a photo he took of himself. It's a self-portrait. He took shortly after Christmas 2022. This is about the last time we saw Connor alive. He was our second son of 4 children. He achieved many things in his 22 years. At 16, he was a licensed radio operator. He became an Eagle Scout before his 18th birthday. During that same time frame, he was studying welding and achieved certifications and became a professional welder before he joined the Army in 2019. Connor was 22 years old when he discharged from the Army honorably in January of 2023. He was a student veteran. He was attending University of Montana Technological Institute in Butte. We last saw our son in person December 31st, 2022, as he drove his Toyota Tacoma across the country to start his new life after the Army. He lived there with his best friend, his Army veteran buddy. They shared a an apartment in downtown Butte, and he was having the time of his life. On March 30th, 2023, he visited the VA one time to establish care post-Army. He was administered the Pfizer-developed PHQ screening test. He scored a 17, and the attending nurse practitioner looked up the results in the DSM assessment guide and determined that he was suffering from depression. And she prescribed him the so-called antidepressant, bupropion, also known as Wellbutrin. What we've come to learn is that that action was negligent on many levels. Connor received a traumatic brain injury, a TBI, while he was serving in the Army. He suffered from many effects of that TBI, including headaches, lack of sleep, vision issues, memory acuity. He was miserable because of the side effects of the TBI, and the Army never helped him with his TBI. He was not depressed. He was miserable. The DoD and VA have a traumatic brain treatment guide that says to avoid bupropion if they have a traumatic brain injury, and yet the VA prescribed this drug to this young man. Apparently, the VA nurse practitioner was unaware of their own guidelines to avoid that drug. Wellbutrin also has a number of manufacturer and industry prescription guidelines and the FDA black box warning. Apparently, the VA nurse practitioner did not know about this, such as don't prescribe them to individuals under 25 years old. My son was 22. Because of the increased risk of suicide that this drug has. If the VA had followed their own TBI treatment guideline, Connor would still be with us. If the VA had followed the black box warning or the industry prescription guidelines, Connor would still be with us. If the VA had followed their own treatment guidelines for starting a patient on a new psychoactive drug regimen, Connor would still be with us. If the VA nurse practitioner had addressed his need for monitoring after starting a new drug program, which they did not do. He never received a follow-up phone call. He never received any attention. He was left on his own. His family wasn't notified. His roommate wasn't notified. His behavioral changes went unnoticed and untaught. And after 8 days of taking the medicine as prescribed, he took his own life. The VA failed to give him a lethal means assessment. He had 6 rifles in his apartment. If this isn't negligence, I don't know what it is. There was a complete failure to obtain Connor's signatory informed consent about the dangers of the drug. There was no effort to understand his military medical history that showed the effects of the TBI and how he started scoring on this PHQ test in a cyclic manner. It was not deep depression. It was not moderate depressive disorder. It was anxiety and misery from symptoms that were keeping him up at night and miserable during the day. And he was never treated for those. The VA used the results of the screening to prescribe the wrong drug based on the test result, where he scored lower than he did when he was in the Army. The Army gave him face-to-face counseling and noted that it was beneficial for him. They never medicated him. Why did the VA medicate him on his first visit? They didn't follow the HIPAA provision that allows for healthcare providers to notify loved ones if there's an imminent danger of death or danger. So the closest people to him had no idea what he was going through. Connor received the medication on April 5th, 2023. He took 8 pills, and he died on the 8th day. April 13th was the worst day of my life. We're asking for Secretary Doug Collins to step up to this. This is a solvable problem, and it's right in front of our face, and they're not changing their policies. I would like Donald Trump to get involved, much like he did with Secretary Pam Bondi, and charge a task force with reviewing this issue and solving it. We believe the suicide rate would drop dramatically if they would pull back on this prescription policy and to actually treat our veterans with the dignity and the health care that they need.